Have you ever wondered what really happens to your body when you go a few days without ejaculating? Does your penis respond differently? Does your testosterone shoot up and your erection get firmer, or is that just something people say on the internet? Many men believe that holding back semen is like accumulating strength, energy, masculinity. But is that really how the male body works? Behind the scenes in medicine, there is a quiet discussion about this topic. And that is what I want to talk about today, without taboo, without judgment, and with what few people have the courage to explain. When you ejaculate, your body releases a series of hormones, dopamine, prolactin, oxytocin, and for a few moments, there is a small internal rebalancing. It is as if the brain breathes with relief. But right after that, it tries to return to baseline, to a point of hormonal balance. And this is when many men feel a sudden drop in energy, focus, and even desire. Now, when you spend some time without ejaculating, whether by choice, abstinence, or simply going through calmer periods, the brain understands this as a new stimulus. It starts to create a slight increase in testosterone, not because semen has been stored, but because the mind associates retention with motivation, and the body responds with more drive. This is the male instinct in action, the same instinct that once made you hunt, compete, conquer. But pay attention, this effect is not infinite. Many men confuse this phase of vitality with something magical or permanent. And that is where the trap lies. The more you believe you are charging power, the more pressure you put on yourself, and that can end up sabotaging your own erection. During my years as a urologist, I have heard dozens of patients talk about this. Men who felt their penis more sensitive, their body warmer, their mind more alert. But also men who, when trying too hard to control themselves, started to live the opposite: anxiety, loss of libido, and even erectile dysfunction. The key is not ejaculating more or less. It is understanding your body, respecting your rhythm, and learning what your testosterone is trying to tell you. Make sure you are already subscribed to the channel, because in the next few minutes I am going to tell you what really changes inside your body when you ejaculate frequently, and what science still has not explained clearly about this. And tell me in the comments, have you ever noticed a difference in your energy or erection when you go a few days without ejaculating? Behind every erection, every sexual impulse, there is a silent orchestra of hormones, nerves, and emotions. And at the center of this symphony is your brain. That is where everything starts, even before the penis reacts, before any touch or heated thought. When you become aroused, the brain sends electrical signals to the testicles saying, "Time to produce more testosterone." This hormone is produced mainly in the testicles, in small cells called Leydig cells. It is what gives you strength, desire, energy, and helps keep your erection firm. But what very few people understand is that this production depends directly on the balance between stimulation and rest. If you ejaculate very frequently, the body can interpret that the job is already done. For a short period, there is a natural drop in free testosterone, the fraction that circulates in the blood and makes you feel like having sex, confident and full of vitality. That is why, right after masturbation or sexual intercourse, some men feel more relaxed, sleepy, and sometimes even a little unmotivated. On the other hand, when the body goes some time without ejaculating, the pituitary gland, a small gland in the brain, starts sending more LH, the hormone that stimulates the testicles to produce testosterone. It is a feedback cycle. The brain notices that there is no frequent release and responds by increasing the production signal. That is why, after a few days of abstinence, you may notice stronger morning erections, more intense sexual desire, and even better mental focus. But you need to be careful with simplistic interpretations. The human body is not an engine that stores fuel. Testosterone rises and falls throughout the day, affected by sleep, stress, diet, exercise, and even your thoughts. And this is where many men get confused. They believe that ejaculating less is the key to masculinity, when in reality the key is maintaining a lifestyle that protects hormonal health. During my appointments, I see men in their 50s and 60s recovering strong erections without depending on medication, simply by understanding how their body responds to sexual frequency. When you know yourself, you take command of your potential. Have you ever noticed how you feel after ejaculating every day for a week? Maybe your body feels more relaxed, but your mind, a little more scattered. Some men describe this feeling as an energy leak. Others say they lose desire more quickly, that their erection takes longer to respond, and that the penis feels tired. This is not a coincidence. When ejaculation becomes very frequent, whether through daily masturbation or repeated sex without rest, the body enters a state of mild hormonal fatigue. Dopamine, the hormone of pleasure and motivation, drops rapidly after orgasm. That is why right after ejaculating you feel that laziness, the urge to lie down, or simply a lack of interest in any other sexual stimulus. And this becomes even more evident as a man ages. After 40, natural testosterone production decreases by about 1% to 2% per year. So when the body is overstimulated, with little recovery time, the response can be the opposite of what you expect: less desire, weaker erections, and even a drop in self-confidence. But it is not just hormonal. There is also the neurological side. Masturbation or sex without intervals creates a pattern of continuous stimulation in the brain. And the more it gets used to this quick release of pleasure, the harder it becomes to maintain control during actual intercourse. This is where many men start to notice symptoms of premature ejaculation and erectile dysfunction. I have heard many patients tell me, "It feels like my body got addicted to quick pleasure." And that is exactly what happens. When the brain associates pleasure with immediate reward, it loses sensitivity to natural pleasure, the pleasure that comes from intimacy, connection, real touch. But again, this does not mean that ejaculating is bad. The problem is in the excess, in repetition without purpose, in using pleasure as an escape from anxiety or loneliness. When masturbation becomes an automatic routine, the body loses part of testosterone's natural power to keep you motivated and focused. So, before thinking about how many times you should ejaculate, ask yourself, why am I doing this? For conscious pleasure, or out of habit? What happens when a man decides to stop for a while? When he chooses not to ejaculate for days, or even weeks, and observes how his own body reacts. Many describe this phase as a rebirth of masculinity. It is as if testosterone gained a life of its own and the penis responded with more firmness, more sensitivity, and more desire. But is this biology, or just perception? The answer is that both factors work together. When a man practices sexual retention, the brain understands that the body is in a period of energy accumulation. This activates regions linked to focus, productivity, and the instinct to achieve. It is as if the body returns to a more primitive state of hunting and competition. In this context, testosterone does not rise in an exaggerated way, but its action becomes more noticeable: more physical drive, spontaneous erections, increased confidence, and even better posture. In the office, I see men report curious changes: my gaze is different, people sense a different presence in me, I feel my body pulsing with energy. These reports are not mysticism, they are reflections of brain chemistry in action. Dopamine and noradrenaline rise, and this makes the brain work like a tuned engine. You feel more alive, more masculine, more aware of your own power. But there is an important point: retaining is not the same as repressing. When abstinence becomes an obsession, the body begins to react with anxiety, insomnia, and even irritability. It is like holding your breath for too long. That is why the key to retention lies in intention. It is not about storing semen, it is about channeling sexual energy into something bigger: your focus, your health, your self-confidence. And there is another detail that few mention: over time, the body adapts. The brain realizes that the pleasure cycle has been delayed and begins to adjust hormone levels again. If retention is practiced consciously, it can heighten the perception of pleasure and improve ejaculation control. But if it is driven by pressure or guilt, the result is the opposite: tension, drop in libido, and loss of naturalness during sex. Balance is the turning point. A man who masters his own body does not need to prove anything. He understands when to hold back and when to release, because he has learned to listen to the signals his penis and his mind are sending. After 40, the male body changes quietly. Testosterone no longer circulates with the same intensity, metabolism slows down, and little by little a man begins to notice subtle differences: less firm erections, shorter orgasms, longer recovery periods. But none of this means desire is gone. It simply means it is time to learn to listen to your body and find the right rhythm between pleasure and rest. During appointments, I often say, the penis is a thermometer of your health. When something is out of balance, hormonal, emotional, or physical, it is the first to signal that. And that is why a mature man needs to learn how to dose ejaculation frequency. Not too little, not too much. The key is the point where pleasure does not drain your vital energy, but renews it. Men who ejaculate every day, especially in an automatic way, tend to report reduced motivation, fatigue, and even loss of interest in partnered sex. Those who go long periods in abstinence, on the other hand, often notice an increase in energy at first, but soon after may feel tension and irritability. Balance lies between these two extremes, and it is individual. Some studies show that, for most men over 40, an average frequency of 2 to 3 ejaculations per week maintains hormonal balance and sexual well-being. This includes masturbation and sexual intercourse. More than a number, what really matters is awareness. The act should be lived with presence, pleasure, and intention. I always tell my patients, the best way to protect your erection is to take care of everything else. Sleep well, eat better, manage stress, exercise regularly. When the body is healthy, the penis follows. And when the mind is calm, testosterone flows naturally. A man who understands this stops living as a hostage to performance. He rediscovers the pleasure of connecting, touching, feeling. Then, erection once again becomes a consequence, not an obligation. When a man discovers that he can increase his testosterone naturally, the first reaction is to look for a shortcut. He starts training more, ejaculating less, changing his diet, all at once. But in a short time, he notices that something is not working. Erections do not improve, desire does not increase, and the body feels even more tired. This is where the most common mistake hides, confusing control with repression. Many men think they have to completely eliminate sex or masturbation to prove they are in control. But the body does not interpret this as discipline, it interprets it as deprivation. And when the brain senses deprivation, it goes into alert mode. Cortisol, the stress hormone, rises, and testosterone falls. The result? Exactly the opposite of what the man wanted. Over the years seeing patients, I have watched this happen over and over. Well-intentioned men who wanted to recover their masculinity, but ended up trapped in cycles of guilt and anxiety. They blamed themselves for ejaculating, felt weak for feeling desire, and over time the penis stopped responding, not due to lack of testosterone, but due to too much mental pressure. When you turn sex into a performance goal, the body loses pleasure. When you turn pleasure into guilt, the mind shuts down. And the result is always the same: difficult erection, fast orgasm, and a sense of emptiness. True balance comes when a man understands that testosterone is neither the enemy nor the trophy, it is part of his nature. It is what gives you energy to achieve, but also to love. It is what makes you seek pleasure, but also teaches you self-control. When you accept this duality, the body responds with power. I always say, there is no such thing as high testosterone all the time. What exists is a body in harmony with what it feels. When you stop fighting your instincts and start understanding them, sex becomes pleasure again, erection becomes natural again, and testosterone does what it has always done: keep you alive. In the end, what truly changes a man is not the amount of testosterone in his blood, nor how many times he ejaculates per week. What changes him is how well he knows himself. A man who understands his own body stops living at the mercy of fear of failing, of not measuring up, of not feeling the same pleasure as before. He discovers that potency is not rigidity. It is awareness. When you learn to observe your signals, when you notice the moment your penis responds naturally, when you feel your body asking for rest or stimulation, you become the owner of your own sexual energy. And at that point, testosterone stops being a number and becomes a sensation. I always tell my patients, a man who lives at peace with his own desire lives in balance with the world. He does not need to prove his masculinity, he radiates it. Testosterone flows from the inside out, reflected in his posture, his gaze, and the way he lives his sexuality, without guilt, without hurry, without fear. Sexual self-knowledge is a form of maturity. It means understanding that pleasure is not a problem, but power. That the penis is just the visible tip of a much greater energy, male vitality. And that sex, when lived with awareness, becomes a source of strength, not exhaustion. If this content made sense to you, make sure you are already subscribed to the channel. And if you want to continue this journey with me, watch the next video, where I will reveal which silent habits are destroying men's testosterone after 40, and what you can do today to change that.